Assalamu alaikum, Dr. Shid Mahmood here. So many of times we advise X-rays in infants who are admitted or comes to OPD as a case of lower respiratory tract infection in our hospitals. So a confusion arises while interpreting these X-rays, and I will discuss this with you in this video. So this X-ray was shared to me by one of my colleague, and the query of the doctor was that the X-ray on the left side of hemithorax, there is some radiolucency that is crossing the midline upper zone. You can very well visualize this radiolucency. So query was that whether this is pneumothorax or some other pathology or it's normal. I also had the similar confusion while interpreting the X-rays which were done while managing the patients in the hospital. So I discussed it with my one of radiology colleague, Dr. Saqib from Children's Hospital Lahore, and he explained to me in very nicely, and I will try to explain it for you. So two things should be kept before interpreting the X-rays for the infants. One is that in infants it is very difficult to get a properly positioned X-ray. Reason being, you need a trained technician for that purpose, and also the most of the infantile X-rays are in supine position, so you can get the element of rotation in that. So this presentation of the X-ray was because of the rotation. When you get a rotated film, you can get one hemithorax more pronounced as compared to the other one, that will be more lucent as compared to the other one, and even such type of radiolucency can be seen that is crossing the midline. So it is neither a pneumothorax nor some other pathology. It is just because of the rotation. So how you confirm that whether it is because of rotation or some pathology? So you check for the position of the X-rays, that how is the position quality of that X-ray film. For that, you first localize the spinous process that is passing through midline of the spine, and you localize the medial end of clavicle. If both ends of clavicle are equidistant from this spinous process, that means that your X-ray film is having properly positioned. If it is not, then it is having element of rotation, and your interpretation will be very difficult and will not be very sure about the cardiac size or about the some hyperinflation. Especially this issue rises while you get a case of foreign body inhalation, where the only finding in case of radiolucent foreign body is that you get an hyperinflated lung on one side as compared to the other side, but you have to this rule out this element of rotation. So what happens in case of pneumothorax? In case of pneumothorax, three things are very important. One is that you will get a line. The line is called as a line that separates the lung parenchyma from the air in the pleural cavity. It is shown as 2 in this marked picture. Second is that you will get a radiolucency that is crossing the midline, and it is shown as a 1. And third is you will get a sulcus sign. Sulcus sign is because the air gets collected in the costophrenic angle, and that will deepens. So it is called as sulcus sign, and you will get these three important things in pneumothorax. So this will be differentiated in considering these three signs. Thank you.